Today, I'm going to share with you 7 essential breastfeeding tips that will help you establish a successful nursing relationship with your baby and overcome the most common challenges that 90% of new mothers face in their first weeks postpartum. But before we dive in, I want to let you know there's a comprehensive free breastfeeding guide in the description below that covers everything from proper latch techniques to milk supply troubleshooting, plus a printable feeding tracker that you can download and keep handy during those first crucial weeks. This guide has helped over 50,000 mothers successfully establish breastfeeding. Also, if you're looking for evidence-based parenting advice and practical tips to make your motherhood journey smoother, make sure you subscribe to my channel and hit that notification bell so you never miss my weekly videos, where I share real solutions for real parenting challenges. If this content helps you, please give it a thumbs up. So you've just welcomed your precious baby into the world, and you're wondering how to make breastfeeding work for both of you. Maybe you're experiencing pain that makes you dread feeding time, worrying about whether your baby is getting enough milk, or feeling overwhelmed by conflicting advice from well-meaning friends, family, and even some healthcare providers. You're not alone in this struggle, and I want you to know that with the right information and support, breastfeeding can become one of the most rewarding experiences of your motherhood journey. The first tip is understanding that the first few days are about colostrum, not volume, and this is where many new mothers unnecessarily panic. Colostrum is often called liquid gold, and for good reason. It's incredibly concentrated with antibodies, immunoglobulins, white blood cells, and proteins that literally program your baby's immune system for life. Research shows that colostrum contains 10 to 17 times more protein than mature milk and is specifically designed to coat your baby's intestinal tract, preventing harmful bacteria from taking hold. Many new mothers panic, thinking they don't have enough milk because they can only express a few drops or maybe a teaspoon of colostrum, but this is completely normal and actually perfect for your newborn. Your baby's stomach is only the size of a marble on day 1, holding just 5 to 7 milliliters, growing to the size of a ping pong ball by day 3. So those small amounts of colostrum are exactly what they need. The composition of colostrum changes daily. On day 1, it's thick and yellow, almost honey-like in consistency. By day 3, it becomes more translucent as it transitions to mature milk. This transition happens gradually over the first 2 weeks, with your milk becoming whiter and more abundant as your baby's stomach capacity increases. Don't supplement with formula unless medically necessary, as this can interfere with your milk supply establishment. Every time you give formula, you're missing an opportunity to stimulate your breasts to produce more milk. Your body operates on a supply and demand system, and those early frequent feedings are crucial for establishing your long-term milk production. My second tip is mastering the proper latch from day 1, because a good latch is literally the difference between breastfeeding success and failure. A proper latch should feel like a strong tugging sensation, not sharp pain. If someone told you that breastfeeding is supposed to hurt, they were wrong. And this misinformation causes thousands of women to give up breastfeeding unnecessarily every year. Here's what a perfect latch looks like. Your baby's mouth should be wide open, covering most of your areola, not just the nipple. Think of it like eating a sandwich. You can't take tiny bites of just the tip. You need to open wide and take a big bite. You should see their bottom lip flanged outward, almost like a fish lip. And their chin should be pressed firmly against your breast. Their nose should be clear or just barely touching your breast. You should see a rhythmic sucking pattern with their jaw moving up and down, and you should hear swallowing sounds. If you're experiencing cracked nipples, severe pain, or if your nipples come out of your baby's mouth looking flattened or misshapen, the latch needs to be corrected immediately. Don't suffer through painful feeding sessions thinking it's normal, because it's not. A proper latch is comfortable and efficient for both you and your baby. To achieve a good latch, start by positioning your baby tummy to tummy with you. Support their head and neck, but don't push on the back of their head, as this can cause them to arch away from you. Tickle their lips with your nipple to encourage them to open wide. And when they do, quickly bring them to your breast. Remember, bring baby to breast, not breast to baby. If the latch doesn't feel right, don't let your baby continue nursing poorly. Gently break the suction by inserting your clean finger into the corner of their mouth and try again. It's better to take a moment to get it right than to endure a painful feeding session that could damage your nibbles and affect your milk supply. The third tip is understanding how milk supply actually works. Because there's so much misinformation out there, it causes unnecessary stress and worry. Your body produces milk based on demand and removal, not on how much water you drink, what foods you eat, or the size of your breasts. This is a hormone-driven process that's incredibly sophisticated and responsive to your baby's needs. The more frequently and effectively milk is removed from your breasts, the more milk your body will produce. This is why those early days of frequent feeding every 2 to 3 hours are so crucial for establishing your supply. Your prolactin levels, which is the hormone responsible for milk production, are highest at night, particularly between 1 a.m. and 5 a.m. This is why that dreaded 3 a.m. feeding session is actually really important for maintaining your milk production. Your body also produces a protein called FIL, or feedback inhibitor of lactation, which accumulates in your breasts when they're full and signals your body to slow down milk production. This is why it's important to feed frequently and drain your breasts well during each feeding session. Around day 3 to 5 postpartum, you'll experience what's called your milk coming in. This is when your milk production dramatically increases, and you might notice your breasts becoming much fuller, warmer, and possibly uncomfortable. This is completely normal and shows that your body is responding appropriately to your baby's needs. Your milk supply will continue to calibrate over the first 6 weeks as your body learns exactly how much milk your baby needs. Some days you might feel like you have less milk, and other days you might feel very full. This is normal variation, not a sign that something is wrong. Certain medications, medical conditions, and previous breast surgeries can affect milk supply. But for the vast majority of women, inadequate milk supply is not the real issue. More often, it's a latch problem, feeding frequency issue, or normal newborn behavior being misinterpreted as hunger. Fourth, learn to recognize your baby's hunger cues before they start crying, because this will transform your breastfeeding experience from stressful to peaceful. Early hunger signs include rooting, which is when your baby turns their head toward anything that touches their cheek, making sucking motions with their mouth, bringing hands to mouth, increased alertness, and restless movements. Crying is actually a late hunger cue, and a crying baby is much harder to latch because they're already stressed and their body is flooded with stress hormones. A stressed baby will often arch their back, clench their fists, and become rigid, making it difficult to achieve a good latch. When you wait until your baby is crying to offer the breast, you're making the feeding session more difficult for both of you. Newborns typically show hunger cues every 1.5 to 3 hours, but this can vary significantly. Some babies are naturally more frequent feeders, while others go longer between feeds. Growth spurts, which commonly occur around 2 to 3 weeks, 6 weeks, 3 months, and 6 months, will temporarily increase feeding frequency as your baby signals your body to increase milk production. Watch for these early signs and offer the breast promptly. During the first few weeks, it's better to err on the side of offering too frequently rather than waiting too long. Remember, breastfeeding isn't just about nutrition. It's also about comfort, bonding, and meeting your baby's emotional needs. You'll also learn to distinguish between different types of crying. Hunger crying typically starts as fussing and escalates gradually, while other types of crying might be more sudden or have different patterns. Over time, you'll become an expert at reading your baby's unique signals. My fifth tip is about positioning and comfort, because your physical comfort directly impacts your baby's ability to feed effectively and your overall breastfeeding success. There are multiple breastfeeding positions, and finding the right one for you and your baby can make all the difference, especially as your body recovers from childbirth. The cradle hold is the most traditional position, where you hold your baby across your body with their head in the crook of your arm. This works well once you and your baby are experienced, but it can be challenging for beginners because it offers less head and neck support for your baby. The cross cradle hold is often better for newborns because it gives you more control over your baby's head and neck. You hold your baby across your body, but support their head with the opposite hand, allowing you to guide them to the breast more easily. The football hold is excellent for mothers who've had cesarean sections, have large breasts, or are nursing twins. You tuck your baby under your arm like a football, with their feet pointing toward your back. This position keeps pressure off your abdomen and gives you excellent visibility and control. The side-lying position is wonderful for night feeds and when you need to rest. Both you and your baby lie on your sides, facing each other. This position is particularly helpful during those frequent nighttime feedings and can help you get more rest. Regardless of which position you choose, make sure you're comfortable and well supported. Use pillows to support your arms and bring your baby to breast level rather than hunching over. Your back should be straight, your shoulders relaxed, and your baby should be tummy to tummy with you. If you're straining or uncomfortable, you're more likely to experience pain and your baby is more likely to have difficulty latching. Consider investing in a good nursing pillow that fits your body shape and nursing style. Some women prefer firm pillows, while others like softer support. The key is finding what works for your unique body and situation. A sixth tip is knowing when to seek help, because many breastfeeding challenges can be resolved quickly with proper guidance, but waiting too long can make problems worse and more difficult to fix. Breastfeeding shouldn't be painful beyond the first week as your nipples adjust to this new experience. Seek help immediately if you're experiencing persistent pain, cracked or bleeding nipples, signs of infection like fever or flu-like symptoms, or if your baby isn't gaining weight appropriately. A lactation consultant can identify problems that might not be obvious to you or even to your pediatrician. Warning signs that require immediate attention include fever above 100.4 degrees Fahrenheit, red streaks on your breast, a hard lump that doesn't soften after feeding, yellow or green nipple discharge, severe pain that doesn't improve with position changes, or if your baby seems constantly unsatisfied despite frequent feeding. Most hospitals and pediatric offices have lactation consultants available, and many insurance plans cover these services under the Affordable Care Act. Don't hesitate to use these resources. They're there to help you succeed. You should also trust your instincts. If something feels wrong, it probably is. You know your body and your baby better than anyone else. Don't let anyone dismiss your concerns or tell you to just push through if you're experiencing significant problems. Early intervention is key to breastfeeding success. Many issues that seem major can be resolved with simple adjustments to positioning, latch, or feeding routine. The sooner you address problems, the easier they are to fix. My seventh and final tip is to trust your instincts while staying informed, because every mother-baby pair is unique, and what works for your friend might not work for you. Don't let others make you feel guilty about your choices, whether you breastfeed for 3 months or 3 years. The World Health Organization recommends exclusive breastfeeding for the first 6 months, followed by continued breastfeeding along with appropriate complementary foods for up to 2 years or beyond. But your personal circumstances and choices are valid regardless of these recommendations. Focus on what feels right for your family while staying educated about best practices. Remember that fed is best, and a stressed mother struggling with breastfeeding isn't helping anyone. If you need to supplement with formula, use a breast pump to maintain supply, or make other adjustments to your feeding plan, that's perfectly okay. Stay informed by seeking out evidence-based resources from reputable organizations like the American Academy of Pediatrics, the International Lactation Consultant Association, and La Latch League. Be wary of advice from social media groups or well-meaning friends that isn't backed by scientific evidence. I want to emphasize that breastfeeding is a learned skill for both you and your baby. It can take several weeks to feel natural and comfortable, so be patient with yourself and your little one. The first 2 weeks are typically the most challenging as you're both learning. But with proper support and information, most women can successfully breastfeed if they choose to. The benefits of breastfeeding extend far beyond nutrition. Breastfeeding helps your uterus return to its pre-pregnancy size, reduces your risk of breast and ovarian cancers, and can help with postpartum weight loss. For your baby, breastfeeding provides optimal nutrition, immune protection, and promotes healthy brain development. One crucial thing to remember is that your mental health matters just as much as your physical health. If breastfeeding is causing you severe anxiety, depression, or interfering with your ability to bond with your baby, it's okay to make adjustments. A happy, healthy mother is what your baby needs most. Remember that breastfeeding is just one part of motherhood. You're not a failure if you face challenges, need help, or decide to make changes to your feeding plan. You're learning one of the most complex skills in human biology, and that takes time, patience, and often professional support. If you found these tips helpful, please subscribe to my channel for more evidence-based parenting advice. And I'd love to hear about your breastfeeding journey in the comments below. What challenges have you faced, and what tips have worked best for you? Your experiences could help other mothers who are just starting their breastfeeding journey.